Okay, so graduation season is here, caps are flying, birthdays are coming up. And, for young adults and military families, these big life changes, they aren't just about celebrating.
No, definitely not. They can really impact practical things.
Yeah.
Like health coverage.
Exactly. As young adults get older or maybe graduate, their TRICARE situation can change.
And understanding those changes, well, it's absolutely key.
Which is precisely what we're diving into today. We're looking at a TRICARE Communications news article. It's called Learn About TRICARE Health Plan Options for Young Adults.
Yeah, and think of this deep dive as like your guide through that. We want to unpack what happens with TRICARE when a young adult child hits certain ages or maybe finishes school.
Right.
We're pulling out the essentials so you don't have to wade through all the regs yourself.
Yeah, because whether you're the young adult trying to figure this out or maybe a parent helping, healthcare stuff can feel, well, overwhelming.
It really can.
So our mission here is just to cut through that noise, make it clearer, and focus on what matters most for your situation.
Okay, so let's dig into the source material. The article kicks off by mentioning these transition points, right? Graduations, birthdays. And it quotes Deborah Fisher. She's a health system specialist with the DHA. She points out that these moments are exactly when TRICARE eligibility can shift.
And Fisher really emphasizes that getting ahead of it, like understanding the options before the change happens, is crucial.
Yeah.
So the young adult can make, smart choices about their future coverage. It's about planning ahead.
Absolutely. Not getting caught by surprise. So where does it start? The article says the baseline is children usually stay on their sponsor's TRICARE plan until they're at least 21.
Okay, 21. That's the sort of standard point. But there's a big exception, right? Especially for college students.
Yes, exactly. And this is really relevant for a lot of families.
Yeah.
If the young adult is enrolled full-time.
Full-time, okay.
At an approved institution of higher learning.
And sorry, just quickly, approved institution, that basically means like accredited colleges, universities, vocational schools, things the government generally recognizes.
That's the idea, yes. So if they're full-time there and their TRICARE sponsor is providing over half, more than 50% of their financial support,
okay,
then they might get to stay on that existing plan a bit longer.
How much longer?
Until they turn 23 or they graduate, whichever comes first.
Got it. So 21 is the base, but maybe 23 or graduation for students who qualify. But the article highlights something really vital to make that extension actually happen, administratively speaking.
Yes, this is the step you just cannot skip. If your child is going to college under these rules, you have to update their student status in DEERS.
DEERS, the Defense Enrollment Eligibility Reporting System, that foundational database.
The one and only.
Yeah.
And if they move for school, their address needs updating in DEERS too.
Right.
The article really stresses this because if DEERS isn't right, oh man, it can cause huge headaches. Like claims getting denied or the system just showing them as ineligible when they actually should be covered. DEERS has to be accurate. It's sort of the bedrock of their coverage.
Understood. So baseline to 21 may be extended to 23 or graduation for qualifying students if DEERS is kept perfectly updated. What happens when that initial eligibility runs out? They hit the age limit.
Okay, so this brings us to the main pathway the article talks about. TRICARE Young Adult. Usually called TYA.
TYA.
It's a program specifically designed for those children who lose their standard TRICARE eligibility because of age.
And what are the key requirements to get into TYA?
The source lays them out pretty clearly. The young adult, they need to be unmarried.
Okay.
A child of an eligible sponsor, obviously, they have to be at least 21, but not yet 26.
21 to 25, basically.
Right. And importantly, they can't qualify for their own employer-sponsored health plan
Okay.
or be eligible for other TRICARE plans. And they can't be an active member of the uniformed services themselves.
So it really is tailored for that specific gap. Young adults, aged out of regular coverage, don't have a job with insurance yet.
That's precisely the window it's meant to fill. And TYA isn't just one single thing. You usually have two flavors, depending on the sponsor's status and where the young adult lives.
Okay.
There's TYA-Prime and TYA-Select.
All right, let's break those down. TYA-Prime, what's that like?
TYA-Prime works a lot like the regular TRICARE Prime your sponsor might have. Care is mostly through military hospitals and clinics. You generally need referrals for specialists. The main advantage is usually lower out-of-pocket cost once you pay the monthly premium.
Okay, lower cost, more structure. What about TYA-Select?
TYA-Select offers more flexibility. The young adult can see pretty much any TRICARE authorized provider, civilian doctors, specialists.
Without needing referrals, usually.
Right. For most care, no referral needed. The trade-off, though, is you'll likely pay more out of pocket. Think deductibles, co-payments. Those will be higher than with TYA-Prime.
Makes sense. So it's that classic choice. Potentially lower costs, but a managed care system with Prime, versus more provider freedom, but potentially higher costs with Select.
You got it.
Do both TYA options cover the same basic things, like doctor visits, prescriptions?
Yes, the article confirms that. Both TYA plans cover medical services and pharmacy benefits. They also cover routine eye exams.
Oh.
But what they don't automatically include is, like, full vision coverage for glasses or contacts or dental care. If you need those, that's extra. Separate purchase required.
And this is a big difference from being covered as a child beneficiary, right? TYA costs money each month.
Oh, absolutely. There's a monthly premium just to have the TYA plan. That's a major change from being on the sponsor's plan without that direct premium cost, plus other costs depending on the plan and usage.
Right. So TYA can potentially cover them until age 26 as long as they still meet the rules. When does TYA coverage actually stop?
It ends basically when any of those eligibility criteria we mentioned are no longer met. So turning 26 is the big one. Or if they get married. Or if they become eligible for an employer-sponsored health plan through their own job.
Or if they become eligible for another type of TRICARE plan somehow.
Yes, that too. Or, and the article points this out, if they just decide to end their TYA coverage voluntarily, they choose to drop it.
Okay, what happens then if they choose to end it? That sounds like something important to know.
It really is. The source is specific here. If a young adult voluntarily drops TYA, they generally face a 12-month lockout period.
12 months, a full year.
A full year where they cannot purchase TYA again.
Wow. So if they think, oh, I'll just drop it for a few months and then want it back, they could be stuck without TYA for a whole year.
That's the risk, yes.
Right.
It's basically a rule to discourage people from jumping in and out of coverage only when they think they might need care.
Okay, that makes sense. Are there exceptions? Times when that lockout doesn't apply?
Yes, thankfully. The article clarifies the lockout doesn't happen if they end TYA because they got a job with insurance.
The employer-sponsored plan scenario.
Right. Or if they became eligible for other TRICARE coverage for some reason. The lockout is really about voluntarily dropping it when you don't have one of those specific qualifying events lined up.
That is a really critical detail to understand. Okay, let's shift gears slightly. What if someone loses their regular TRICARE? Maybe they hit 21 or 23 and they don't sign up for TYA. Or maybe they do have TYA but lose eligibility before 26. Say they get married but they still need coverage for a bit. Is there any kind of bridge option?
Yes, there is. The article brings up the Continued Healthcare Benefit Program, CHCBP.
CHCBP.
Exactly. This program is really designed to be a temporary bridge. Think of it as connecting TRICARE coverage to finding civilian health insurance.
How does it work? Is it similar to TYA?
It's also premium-based, so yes, you have to pay for it monthly. It offers the same coverage level as TRICARE Select.
Right, so the select level of benefits.
Right, and it provides temporary coverage, the article says, up to 36 months after losing that prior TRICARE eligibility.
36 months is a good chunk of time. But is there a catch? Like a deadline to enroll? Timing feels crucial here.
It absolutely is.
Yeah.
This is maybe the most critical point about CHCBP. The source states very clearly, to enroll, your application must be submitted within 60 days.
60 days. 2 months.
60 days from losing your previous TRICARE eligibility. If you miss that 60-day window,
you're out of luck for CHCBP.
That's right. You miss the chance to enroll in it.
Wow, 60 days is not long at all, especially if you're dealing with graduation, a move, starting a new job. That's definitely a date to circle on the calendar if CHCBP might be needed.
For sure. Put a big star next to that one. And the article kind of wraps up by circling back to the main message from the start,
which is
the importance of researching these options early, knowing what's out there before you hit the deadline, and contacting your regional contractor if you have specific questions about your situation.
Right. Don't wait until the last minute. And they also loop back to that foundational point we talked about earlier, DEARS. Keeping it updated, changes in student status, address, anything significant, it's just essential for making sure the right coverage is in place at the right time.
Absolutely. You know, what really strikes me looking at all this is how everything connects.
How so?
The timing of life events, birthdays, graduation, the specific rules for each program, TYA versus CHCBP, And those administrative tasks, especially keeping deers updated, they all have to line up just right for coverage to transition smoothly.
Yeah, that's a great summary. So just to quickly recap the pathways we've covered from the source article, we started with that baseline TRICARE coverage for a child, usually until age 21.
Or potentially longer, maybe to 23 or graduation, if they're a full-time student meeting those specific conditions.
And critically, if their info in DEERS is kept absolutely current.
Right. Then, when that standard eligibility ends, the main option is TRICARE Young Adult, TYA. We talked about who qualifies.
Unmarried, 21 to 25, no employer plan, etc.
The difference between TYA-Prime and TYA-Select.
Cost versus flexibility.
And the various ways TYA coverage can end, like aging out at 26 or getting married.
And let's not forget that really important detail about the potential 12-month lockout. If you voluntarily drop TYA without a qualifying reason, like getting another plan.
Crucial point. And finally, we looked at the Continued Healthcare Benefit Program, CHCBP, as that potential temporary bridge.
Offering TRICARE Select type coverage for up to 36 months.
If you apply within that very strict 60-day window after losing your other TRICARE.
It all really hammers home that point from Deeper Fisher in the article. Understanding these options before the changes happen is the key. It allows you, or your young adult child, to make well-informed decisions about healthcare coverage down the road. The source material basically lays out the map and the rules of the road.
Which, brings up a really practical question for you listening right now.
Yeah.
Given these different routes we've discussed, staying on the plan through college, maybe moving to TYA, potentially needing CHCBP as a temporary fix, what specific date or upcoming milestone should you be thinking about right now? Is it a 21st birthday? A 23rd graduation day?
And based on that specific date and everything we've just talked about, what's maybe the single most valuable next step for you to take? Is it double checking DEERS right now? Is it starting to research TYA premium costs? Or maybe just marking that potential 60-day CHCBP window on your calendar?
Think about that specific date, that key milestone for you, and identify that immediate next action step.